I've got a sore back. I'm a little bit skeptical as to the role of psychology when it comes to my very physical pain problem that feels like, it's very centered to my lower back. How would you explain the role of psychology and how you could help?
Great question.
This podcast is not personalised medical advice. Consult a health professional before acting on anything discussed. Just give me 30 seconds before we start. Whether you're a clinician wanting better outcomes for your patients, someone living with chronic pain, or supporting someone who is, thank you for being a loyal listener. Most regular listeners haven't hit follow yet. If that's you, please tap it now. It tells the algorithm to show this to more people it can help, and that's the single biggest thing you can do to help me and my guests on our mission to create a world with a little less pain.
Sophie, you and I work together at managing pain. You have long wait lists as a pain psychologist, and you don't need to convince me how important your role is in pain and the patients that you work with. But just assume that I'm coming in. I've got a sore back. I'm a little bit skeptical as to the role of psychology when it comes to my very physical pain problem that feels like, it's very centered to my lower back. How would you explain the role of psychology and how you could help?
Great question. And obviously it can feel quite confusing or threatening or invalidating to receive a psych referral for pain, for back pain, for chronic pain. So yeah, I think for me, just like forming a connection with someone, building rapport and relationship is the first starting point, I guess, as it would be in any psychology session. But yeah, I think initially just supporting that person to feel like I'm on their side. I'm, like believing what they're telling me. I'm hearing their story. And yeah, just kind of understanding like their perspective of it. They might have heard multiple different views or opinions from the health professionals they've seen, but that doesn't always match how the person kind of sees that story for themselves. So understanding like the experience from their perspective, just as a starting point to sort of see like how I can meet them where they're at in making sense of what they're experiencing.
Yeah, that's huge. And it's definitely an important starting point. Okay. So imagine I like you. I think you believe me. I feel like validated. But I'm still like, what are you going to do for me? How would you help me? How would you explain that?
Yeah. So, where you and I work at Managing Pain, we've got the pain specialists and doctors on site. We've got access to those case notes. So it's helpful for me to, again, see like what's going on for that person in terms of their pain and their injury. And usually if they've been referred to a psychologist, there might be, like a nervous system component or a stress component or something more going on explaining their pain more than just the physical damage. So usually I'd sort of approach it by helping that person to notice patterns in their own pain experience. Like, have they noticed when they're not sleeping well or when they're more stressed, are they having more pain flares, or are there things that make their pain better or worse that don't relate to, new damage in their body? So helping them kind of notice those things for themselves, and then I'll kind of go in there with more of my own kind of education about it.
Yeah, that's awesome. What is the role? You mentioned the nervous system, and I think nervous system regulation is like a bit of a buzzword that goes around. What is nervous system regulation? How can it change someone's pain experience?
Great question. So, like when I talk about the nervous system with clients, I'll often use like the analogy of window of tolerance, where they've got kind of like a sweet spot in the middle, which is when you're within a comfortable zone of arousal. And then outside of that, you've got hyperarousal when you're in that fight or flight state, and then hypoarousal beneath that when you're in like a numb, disconnected, flat, checked out space. So I'll often kind of go in quite early with this concept with clients to help them make sense of those different nervous system states, because oftentimes someone who is experiencing pain or stress or is dysregulated is spending quite a bit of time outside of that comfortable space, being in a lot of pain, not sleeping well, experiencing trauma, are all things that can narrow your comfortable window. So, many clients will report feeling quite on edge and irritable or anxious, not sleeping well, all of those things, which are, can be signs of being in that more kind of hyper alert, hyper aroused state. So I'll usually share that education with clients, help them notice their own kind of signs of when they're in those different states. And then ultimately, what can we do to come back into that window when they've become dysregulated, or how to widen that.
I feel like there's a degree of awareness that has to come to be able to notice that you're in that kind of state. And I find not everyone, that probably doesn't come naturally to everyone. What are some signs, or what are some things that you could notice that would show you that you're in the hyperarousal state?
Yeah, great question. And I do use a lot of visuals with clients to help them understand these concepts. So something like a map of the body and how the fight or flight response shows up in terms of heart racing, feeling breathless, feeling hot and sweaty, where in the different parts of the body can those signs show up. And these are things that overlap so much with feeling like your heart's racing or feeling sweaty or nauseous can happen for so many different reasons. But I guess, educating someone what to look out for and that kind of pattern of responses that can happen in the fight or flight state. It can take time to connect that to their own experience, and it's going to show up differently for different people. But it can be an eye-opening moment for someone to notice me feeling nauseous or appetite loss and things like that could actually be related to my stress or anxiety or trauma responses or something like that.
And what about the low state, so the hyperarousal state? What are some signs for that state?
Yeah, so I guess a common feature of both is feeling quite disconnected from the present moment. So in the hyperaroused state, it might be feeling numb, dissociated, checked out, withdrawn, flat. Some clients have shared things hours might pass and they've not been aware that time has passed, or feeling a sense of just wanting to withdraw and hide away.
And once you've discovered these states, how do you link that to pain and how pain works and what role that might be playing in their experience?
Yeah, so there's so many different avenues we can go depending on if the person's got a trauma background, which can often co-occur with pain, or if someone's had a workplace injury and there's been a physical injury, but then a psychological injury with that, that window of tolerance can be very affected by trauma triggers, and more pain can come with that as well. But generally for someone experiencing pain, we'll often see during a pain flare or a bad pain day, generally someone might say I just get more irritable, I'm more snappy at my family, or I feel I just can't be around anyone, and starting to see more of those signs of the same things are happening during their day, but they're really kind of fluctuating outside of their window of tolerance. So we can talk about ways to kind of ground and regulate in those moments, but then also bigger picture, how can we understand the person's like patterns and behaviors around pain and managing pain flares to kind of reduce the frequency and intensity of that, where they're not, hopefully having as many really bad pain days or pain flares.
What is it like? What influences someone's nervous system regulation? Like, I know that, for instance, with chronic pain, the more adverse childhood events someone has, the greater the likelihood that they might experience persistent pain in later life. What kind of shapes someone's nervous system and that window of tolerance?
Totally. Yeah. So many things, like from very early life, can begin to shape that. And early experiences of feeling unsafe, it is when the nervous system can learn to become overprotective. And it's those ways that we learn to cope early in life that, like in an unsafe or a challenging situation, that can carry through with us as we get older. So, and because of like the way our brains work, we might continue to kind of seek out environments that feel familiar to that as we get older. So it can be really difficult to help the nervous system to recognize what feels safe, or there's so many factors that can influence that, both in early life and then as we get older, going through different life stressors can, for many people, lead to a sense of feeling unsafe or dysregulated.
And what about, like, I guess, big traumas? Like, obviously, I don't like to really say it like that because obviously there's so many different things that happen. But I guess what I'm saying is that, like, obviously it doesn't need to be this like massive thing. Sometimes it's just like these constant ways of moving through the world that people have that, it might have been very adaptive at the time to, please everyone and not, make your requests and needs and feelings known. And then you kind of develop that throughout life. But what happens on like the flip side, where there is like a very traumatic event, which we see often in the clinic?
Yeah, exactly. Well, like when it comes to a traumatic event, not everyone who experiences a traumatic event will necessarily go on to develop like PTSD or consequences from that. But it can show up in so many ways. Like trauma can be, like you said, something that's like with complex trauma, something that like there's been a series of ongoing traumas, or it can be a single event. Usually like a single event trauma can sometimes be easier to treat in therapy. And it always depends like what kind of, resources and protective factors that person's coming with as to what the impact of that single event trauma is going to be, and, their access to therapy and things like that. But it's interesting how that relates to, whether someone does go on to develop pain. It's not necessarily always the case, but it can definitely predispose someone to having the type of nervous system that is more overprotective.
You after my last podcast, you sent through a message around that you were quite interested in the discussion around PTSD, sometimes leading to physical like manifestations of pain within like a limb or whatever, and sometimes not. And the question that I got from a psychiatrist was, why don't all people with PTSD develop physical bodily pain? Do you have any thoughts on that?
Yeah, again, I wish I had like the answer to this question. I just think it's just interesting to think about like all of the factors that go into that. Like, again, just, like what are the protective factors that someone has in place? Like we talk about adverse childhood experiences, but like what were like protective childhood experiences that person had that like buffered against it, or when it comes to like PTSD, what access to treatment did they have at the time? What like other stressors were going on in their life? What resources did that person have? And I guess when it comes to like pain and trauma, these are things that can disproportionately impact people, dealing with like challenging life circumstances. So, there can be so many kind of like social factors or, like barriers when it comes to access to support that can unfortunately prolong or amplify pain for some people.
Yeah, and I guess like there's different ways that the nervous system becomes like heightened or overprotective, and I guess pain is one of those ways, but there's other symptoms of PTSD that also
Exactly
show signs of that kind of overprotective state. So I guess it just can manifest in different ways. And I think you kind of shone, like as I've reflected on that question, talked to a bunch of people and as well as yourself, that's kind of where I've landed, is like we don't really know why some develop pain and others don't, but they develop some sort of protective output. And in this case, in some cases, that protective output is, physical embodied pain symptoms. I want you to explain, or at least your thoughts. This might be something you can't answer as well, exactly the way, people like that, yes, no kind of answer, or that very black and white answer. But why do some people not develop PTSD after a traumatic event? Do you have some thoughts around why that might be?
Yeah, I guess it like depends on the nature of the trauma and like again what happened in the person's life before and at the time of it happening. I recall from some PTSD training I did that women are more likely than men to go on to develop PTSD, and particularly if it's an interpersonal trauma, can be like a type of trauma that can be more likely to become PTSD. So I think that's a factor. And again, like what sense of safety does the person already kind of have in their life when the trauma occurs? If I'm seeing a client who like is still in a situation that's quite like unsettled or unstable, it's going to be very difficult for for us to kind of work through that trauma until they can get to a place of kind of stabilization where we can start to form that distinction between like past and present. So in like the first phase of any trauma treatment, it's reaching that place of safety and stabilization, and like supporting the person to come back to window of tolerance, widen the window of tolerance, feel settled in the therapeutic relationship. But like if the person's in a situation where there's still a sense of threat or dysregulation, it can be difficult for that to heal.
How does someone widen their tolerance, their window of tolerance? Because that, like, as someone that's quite driven and wants to like make an impact or dent on the world, like I think sometimes I definitely fall out of that window of tolerance, and like my instinct is like I'd still want to do so much, so it's like, can't I just like become more resilient and like grow that window of tolerance? Is there ways, or is it kind of fixed?
So I guess like basic things like as best we can, kind of having good like sleep and nutrition and social support, stable living environment, and those sorts of things. Like I guess all of us, you get like hangry and irritable when you've not eaten or slept well. So all of those like lifestyle factors make a difference. But then it's like having a good relationship with your therapist, with your treating team. But then also graded exposure and gradually doing things that extend like towards the edge of that window and helping like your nervous system to learn to cope in those situations. And I guess that like graded exposure approach is something that you probably use with your clients as well. Just like, you know, we can't go 0 to 100, and so relevant when it comes to pain. We have to kind of like help, like when it comes to increasing like movement or activity, do that in a gradual way so your body and your brain, your nervous system can learn to adjust. And it's the same when it comes to helping someone to like widen that window of tolerance. It's doing that in a gradual way.
Yeah, we definitely use some very similar concepts, like one of them being allostatic load. And I use like a bucket analogy, and there's, from a mechanical, very physical standpoint, there's two options really when it comes to pain. Is we reduce the load so that your capacity is enough to withstand it, and your tolerance level is enough. But we can't do that forever. It's sometimes helpful early days, especially when pain is overwhelming. But at some stage, we kind of just need to get a bigger bucket. We need that to grow. And like you say, there's ways to do that: pacing, graded exposure, which is actually quite a complicated task. Especially, I use things like steps and try to objectify it a little bit, but it can be quite challenging, especially when I know as a physio that like it's not just the mechanical things that change the size of that bucket. So like, yeah, I can focus on the physical load, but then there's all these other things that also contribute to how much tolerance they have. But I want your thoughts on because I like doing things that are hard on purpose. Like ice baths or whatever it may be. I like doing physically challenging things when I'm in control. And I feel like that, I'm wondering whether that grows our window of tolerance.
Totally. Yeah. Like through exposing ourselves to situations where we might become, like a little bit more dysregulated, or it's outside of our comfort zone. There can be a process of habituation which occurs where, as you stay in that environment and don't avoid or escape it, our distress might escalate, but it's not necessarily going to stay that high indefinitely. We want to stay in that situation until it starts to come down, as long as it's like, we're not too like completely overwhelmed or dysregulated. It's again just like pushing outside, noticing that distress rise, staying in that situation until it starts to settle, and then we might find the next time we do it, it's not kind of spiking as high as it did that first time. And using like coping strategies to kind of like ride that out and not leave straight away is a really great way of like helping your nervous system to tolerate situations beyond like what it currently can.
For sure. I think I wonder if there's a difference. Well, I think it's obvious, like that there's a difference between whether you feel in control or not in that situation. Because, if I use the ice bath analogy, like I can sit in there knowing that I could get out at any stage and like push myself to go a little longer. But if someone was holding me down in the ice bath, it's a total different ball game, right? So yeah, I often encourage people to do some hard things that they feel like they're still in control. And now, obviously, someone doesn't necessarily have to be holding us down for us to feel out of control. But it's kind of like teetering on the edge of like where you feel you can do it, you can achieve it, and you're in control of the situation.
There's so many things that like modify the intensity or the challenge of these kind of exposure tasks. And for so many people, some of the situations that feel most distressing are ones that like where we're kind of trying to tolerate like uncertainty or like a lack of control and predictability. So that can be like an important kind of thing to face to an extent, like where it's still safe and when it's helping us.
Yeah. What do you do when it's out of control? Like, because I find that that's probably the hardest way, like, time for me to like regulate is when I'm like, okay, this thing's happening, it sucks, but I can't control it. Like, because sometimes I'm in control, and I'm a bit of probably a control freak where I like to, be able to change the trajectory of what's going on. And then there's situations that are like outside of me, and then that makes it more challenging. How would you approach that?
Yeah, well, like usually, in psychology with graded exposure, it's just setting up kind of behavioral experiments to test this out. It depends like what kind of uncertainties we're learning to tolerate. But just trying to think of an example. Like that, there's like there can be uncertainties or uncontrollable things just in terms of like how other people might perceive us, or like predicting what's going to happen in the future, or things like that. But often in situations where we feel like not in control or vulnerable, we might have like safety behaviors or things we do to try and like self-soothe or regulate or manage during that. It might be like when you're in a social situation and feeling like not in control, maybe it's like going on your phone or doing something to kind of like avoid like the intensity of that experience. For someone who's feeling like socially anxious, not being able to kind of predict and control how others are perceiving them. So often it's like noticing what are these kind of safety behaviors or things we do to like subtly avoid the intensity of that situation, and like just gradually reducing that, or like facing the experience in its entirety, like dropping some of those safety behaviors gradually.
Yeah, interesting. Let's get practical now, because I'm convinced that the nervous system is an important player in it, and the role of psychology on that. One thing that I say is, if we didn't have a nervous system, we wouldn't feel pain. And interestingly, if we don't have that limb that's painful, sometimes we still can feel pain. And that's phantom limb pain. And I find that little analogy actually can really help people to kind of grasp the idea of, okay, like pain is more than just the body part. Like there's something bigger going on. I'm convinced of that. So let's go to the practical. I hope everyone else is. But if we go to practical things, like what do you do as a pain psychologist? Is it just talk therapy, or are there strategies, which I think is amazing, by the way, and I think education is such a big part of what we do, but are there particular strategies that you use day to day?
Yeah, it's going to be so dependent on like the person and my whole formulation of what's going on for them and what existing strategies they're coming with and all of that. But even just thinking about kind of like some of the core skills we teach in like our group program, for example, like there is a lot of benefit in relaxation techniques, breathing, progressive muscle relaxation, imagery, mindfulness, as a way to help, increase a sense of like safety in the body, come back to a window of tolerance, reduce stress, improve sleep. Even like progressive muscle relaxation is actually one of my favorite techniques to introduce, because, so just briefly, it's, for those who don't know, it's the tensing and releasing of muscles from head to toe or toe to head. And that contrast between tension and release can just provide like a really nice immediate sense of relaxation. And whenever I do it, I find myself just like yawning and becoming really relaxed. Like it's quite got a great evidence base for sleep and reducing stress and anxiety and all of that. But it can also be so helpful just for people to become a bit more aware of like when they are carrying tension in your body. So often for many of us, it's like you might be kind of like hunching your shoulders or clenching your jaw or holding onto tension without realizing that you're doing it. And doing an exercise like progressive muscle relaxation is just a really nice way of like becoming more in tune of those early signs of like stress or dysregulation or hyperarousal in your body as you are kind of becoming more tense or holding more of that, and having this as a tool to like release that, but also even just to kind of like drop your shoulders or exhale or help your body to feel a little bit more relaxed throughout the day.
Yeah, that's fascinating. The reason it's fascinating, I use this therapy called cognitive functional therapy a lot. Peter O'Sullivan's, the main driver of that. He's a leading researcher in lower back pain, and he talks about like protective behaviors and protective muscle guarding that goes on in chronic pain, and how to reduce that. And I do these little practical experiments with people with low back pain where I get them to try different movement experiments, like one where like they'll breathe in through their nose, and then as they're exhaling out through like a deep breath, they'll bend forward, and we just compare like how does it feel when you do what you usually do versus like this technique. And the theory around it is that they're relaxing muscles in around that area, which allows them to move more freely. But I think there's probably a layer of like actually the nervous system component to the deep breath that actually changes the interaction. But so many times people go, oh, wow, that's so much better. And what's interesting and where I find it challenging is because like there's a long history of like posture, core strength, like making sure the back is stable and like it's this fragile, body part, etc., which is just doesn't hold much evidence. But yeah, that actually experimenting and then being able to experience that, it goes so much further than me just explaining, what, core's a bit overrated, like there's nothing wrong with your core strength. But when they experience it, it's a whole different thing. And yeah, it's a similar kind of idea. Maybe I should use the contract relax techniques as a movement experiment, see how it goes.
Yeah, like another kind of like analogy I'll use is the one of the stress bucket, where it's like, for many people, we all have a different stress tolerance, and that's represented by our stress bucket. And we have, warning signs of when that bucket's starting to fill up. Again, maybe noticing we're a bit more irritable or more tense or not sleeping as well. And we're very good at noticing when that bucket's like at peak or overflowing. Everyone around us will obviously notice that. But it's kind of noticing, like, again, those early warning signs of what that looks and feels like as that's building, and just having tools to like let some of that water out, which things like progressive muscle relaxation and breath work are really good for, which is awesome if you can kind of do that regularly, as opposed to when we get to that like overflow point, it can be a lot harder to use those techniques then.
Are there any other practical techniques that you use kind of like that one?
Yeah, so just to kind of like tie this in with my broader approach, like one of the best kind of like evidence-based therapies we have is cognitive behavioral therapy. That's got a great evidence base for chronic pain, as well as acceptance and commitment therapy. There's other emerging ones as well. But when it comes to CBT, the like thoughts and behaviors are such a big part of that. So helping someone to notice like how they're responding to their pain in terms of like thoughts and beliefs around it. Oftentimes there can be very worrying thoughts and beliefs about pain, like something's seriously wrong, or like I've done more damage, or like this is just going to keep getting worse and worse, which can feel very stressful and overwhelming, and lead to behaviors like avoiding movement or, avoiding seeing friends or doing things that you'd normally do. So I think as psychologists, we have great tools to help people become more aware of those thought patterns, and tying in that psychoeducation around like what have we learned from, your doctors and treating team about what's actually going on in your body, and how can we correct maybe some of these inaccurate or unhelpful thoughts or beliefs about pain to respond in a way that feels more like safe and helpful to your body, basically.
Yeah, that's huge. What about pain reprocessing therapy? There's been, I think that's probably a more recent kind of development in this space. Can you explain what pain reprocessing therapy is and what role you think it plays?
Yeah, so it's a newer therapy, but has some great kind of initial evidence for the treatment of chronic pain, particularly back pain. Probably not as much yet as what we've got for like CBT and acceptance and commitment therapy, but pain reprocessing therapy is about helping your brain to attend to pain sensations through a lens of safety as opposed to threat, when we know that, there is that nervous system component. And the first component of the pain reprocessing therapy is psychoeducation. So kind of like what I'd mentioned earlier, helping the person to notice, like, is there evidence of my pain having a nervous system component? What's this actually telling me? Is my pain telling me that there is something seriously wrong, or is this an overprotective nervous system? And similar to, CBT and these other approaches, it's reframing thoughts around that, and using things like mindfulness techniques to notice the pain and approach it in a bit more of like a neutral way, or through this new lens of safety as opposed to danger. So yeah, pain reprocessing therapy incorporates these sorts of techniques, and has really awesome results in the studies that they have done. So it'd be interesting to see where it goes as more people start using it.
Yeah, for sure. I can see the role that it could play, especially in that sort of more nervous system driven type of pain. What is the role of multidisciplinary teams when it comes to pain?
Yeah, well, given that pain's biopsychosocial, it's not just, chronic pain, it's not just like a medical issue. There's other factors at play, hence why, you and I work at a multidisciplinary pain clinic. There's a lot of evidence to suggest like this is best practice. And, we can kind of see how that plays out in the work that we do. It's awesome for our clients to have, people who specialize in these different components of what they're experiencing that can collaborate and come up with like a shared plan and reinforce a consistent message, because obviously it can be so confusing when you're only getting one piece of the puzzle or kind of mixed messages about what's going on. I think just having a cohesive understanding of what's happening in your body is kind of like a foundation for kind of, obviously knowing what to do about it and moving forward. So I think, it's awesome, like in the work that we do, having the opportunity to collaborate so easily. I think you definitely see the difference as opposed to, working on your own in the space.
Yeah, for sure. I'd say nearly every research article will start with pain is a biopsychosocial problem. It's multifactorial, etc. And then sometimes we just treat it like with one domain, and it's like that doesn't make sense of what we know the science is suggesting. Like, you can't treat a multifactorial problem with a single solution. I guess this is where our paths have crossed, and we're building something together. Do you want to introduce Paced Health and explain, how this came to be?
Yeah, so Lachlan and I have been working together for a little while in, a multidisciplinary team on the Gold Coast, as well as in our own private practice work. We were both doing a fair bit of telehealth and realised, we're both kind of doing this individually, but we're so aligned in what we're trying to do. Why not join forces and be able to offer something that is more multidisciplinary, given what we know about what the research says and the outcomes that we see in clinical practice. So it's been awesome to join forces and create something together, and be able to kind of the overall goal is to be able to connect more people to clinicians who have expertise in this area, who can, willing to and can collaborate more easily, as well as clinicians who really enjoy working in the space to be able to do that kind of work as well. So, it's been really rewarding to see this kind of come to life. We've launched our telehealth service, Paced Health, in the last couple of weeks, and we're bringing together pain psychologists, pain physios, to offer individual sessions, group programs, and might kind of expand the services from there as time goes on. But the vision is to connect more people to the kind of care that we see having most benefit.
Yeah, I remember when we met the first time to discuss, it was kind of a blank slate, and we kind of just realized that we aligned on this fact that sometimes pain care is quite fragmented, and they're getting advice from different health professionals that don't have the time, the resources, and aren't kind of incentivized to communicate well to each other. And the poor patient sometimes gets sort of stuck in the middle going, what's going on? I'm getting all these differing opinions, and like, what actually is happening to me? And I think that's kind of where we aligned. And I remember saying to you, and I don't know whether this is you, I'm going to claim it that I came up with this, but it might have actually been you. But I think I was discussing to you, like, how would it be if we had multiple clinicians in an initial assessment for someone with persistent pain? So what if we had like a pain psychologist, a physio, a dietitian, or a pain specialist in the same room for an hour with the patient?
This was you, by the way.
Yes, I can claim it. Okay, good. Great idea then, obviously. And you love the idea. So that is one of the things that we have, and we'd love to. We haven't had a patient choose this yet, but that option of having like multiple professions within the same room to treat what is, like you said, a biopsychosocial problem with multiple contributing factors, it just makes a lot of sense.
Yeah, and to be able to give people the experience where they're not necessarily having to repeat the same information time and time again. For some people, that can be distressing. It can be, like at times like a painful and emotional journey. Being able to kind of just tell that story once, that's being heard by people who are validating, collaborating, and being able to like take that story from different perspectives and then bring that together as like a shared assessment and plan. I think may be valuable to some people who feel exhausted by the kind of hashing over the same story and information in so many appointments.
Yeah, I'm super excited to make that happen and to see it sort of come to fruition. I think it's a great idea, obviously. Tell me about the name Paced Health. So for those that are listening, I think it's probably important to not assume, but PACED.
Yeah.
Tell us about the name and where that came from.
Yeah, well, we've kind of touched on this in our chat today about like the role of pacing and kind of finding that sweet spot when it comes to, activity and like lifestyle when it comes to pain. There can be those two ends of the spectrum when it comes to like withdrawal and avoidance when there's fear around movement, or more that kind of like boom and bust and pushing through and overdoing. So I found that, it was such a big part of my sessions is finding like the steps forwards and the middle ground between all or nothing when it comes to like activity, when it comes to thought patterns, and what that actually looks like in practice, and seeing myself as someone who kind of like works alongside the person to map out those steps. So for me, the term paced is sort of like you're embodying that practice of pacing, which, is not just something you do once. It's a kind of like a way of living that enables you to do things sustainably and enables you to build up gradually. And it's can be, doing more and more, or it can also be pulling back and kind of like adding in those pauses during the day and emptying that bit of your stress bucket again, so you can do things in a sustainable way to prevent burnout, to prevent, chronic stress and other health conditions that can come with that. So for me, it was just that ethos of like doing things in a sustainable way, your clinicians kind of working with you to map out those sustainable steps.
Straight away, I loved the name, but I also had a little bit of a pushback. I was like, does it have some negative connotations that you got to slow down? Because or kind of you feel like someone's like pulling the reins and slowing you down. And as someone that does want to, make an impact and is quite ambitious and has lived experience with pain, that kind of idea of being restricted or like limited doesn't sit right with me. And obviously that's not the nature of the name or the reason behind the name. And a thought that sort of came to my mind as we've been discussing this, and I've more and more liked the name, is this. I'm a big fan of the Tour de France, cycling in general. And for those that haven't experienced it, you won't fully understand this, but the lead rider is usually protected by the rest of the team. It's actually a very team sport rather than an individual sport, because when you sit behind someone that's pacing you, you're actually protected by the wind, and there's less friction, and you're able to move at an easier but actually more efficient pace. And these connotations kind of really align with the way that I feel my role is as a physiotherapist. Is like they're the champion, they're the leader on the team. I'm there to support them so that they can cross whatever their finish line is and, win, I guess, when it comes to life with chronic pain. And I thought, man, it is such a cool name. And I think there's so many different ways or analogies that you could explain it from, different lenses that explain what we're trying to be about, which is collaborative, supportive, and helping them along the journey. And I think it encapsulates that. So cool name. That one's your name. That was your idea.
I'm glad that the cycling analogy finally got you on board.
Yes. Yeah. No, I always liked the name, but I was also just mindful of my own kind of like hunch with or issues with sometimes that the idea of pacing. Why did you, like, business is not easy. I know that because I'm currently building 2 startups, which is probably not the wisest thing in the world. But what is, why did you choose to build this service, and like what's motivates you?
Yeah, I think, just wanting to take what I've sort of seen and observed and do things in a new and different way, I guess. I know that there's a lot of people doing like awesome work in the chronic pain space, and I wanted to contribute to that. I wanted to create opportunities for myself and others to do our best work, to be able to like work alongside clinicians who are like-minded and create an experience for clients that create the best possible experience for clients. I've been, doing my own thing for a little while in my like own private practice, and have been really enjoying that. But I just had like the biggest list of things that I wanted to like do, and it was always like, okay, when I get time, I'll create these programs, or I'll build these resources for my clients. And I just realized, like, through creating a team of people around me, it's collectively we're going to be able to offer more than what I could do myself. So I feel like I was kind of always headed in this direction, and it's exciting for it to be coming to life.
Totally. Super exciting. Is there a way that people can learn more, or are we looking for, I kind of know the answers to these, but are we looking for other disciplines that might be interested in working with us?
Totally. Yeah. So, well, firstly, our website is up, pacedhealth.com, Paced Health on Instagram. So on there, you can find more about like our services and our approach, and our team and what we're offering. But yeah, we are super excited for any potential, clients to get in touch, referrers to get in touch, or clinicians who feel like this aligns with, the work that they'd like to do in this space. Whether that be psychologists, physios, dietitians, or GPs, pain physicians. We're open to hearing from you and building the team.
Yeah, awesome. I have a question that I ask regularly on this show, and you'd be able to think of many clients, but if you think of someone that's suffering, that's at a very low point with their journey with persistent pain, what would your advice be to them?
Well, I think just that, like, you're not alone in that 1 in 5 Australians experience chronic pain. There can be so much of a stigma given, like, which is surprising given how common it is. I think like many people feel alone in the experience. So I think just, connecting with other people, like being open with friends and family about what you're experiencing can sometimes like reduce that isolation, which is why, like, with the group programs we do, it can be so nice to see people feel like understood and less isolated in the experience. It is really, really tough, obviously. But I think just like finding the right people both in your life and treating team to work with makes such a big difference. Advocating for yourself if something doesn't feel right, getting a second opinion if something doesn't feel right, seeking out like a different psychologist or physio or whatever it might be if you're not quite feeling it's the right fit with your current person. I think that just makes the biggest difference, is like having the right support and relationships around you, amongst other things.
Yeah, it's huge. Amongst other things, what are your other things?
Oh, that could take me down too many rabbit holes, so I'll leave it at that.
No, it's a great answer and very practical. And I think there's certain decisions that I think sometimes living with pain can feel like a little bit out of control. And I think there is hope, and there's a sense of autonomy that can be regained. You can choose certain things, even if that is just the way that you respond to it, or the team that you choose to have around you, which I think is something that you pointed out, and that you're not alone. Like, lots of people experience this, and they come in all different personalities, ethnicities, genders,
ages,
etc. And there are people out there just like you that are experiencing it. I think that's really important advice. Well, thanks heaps, Sophie, for coming on.
Thanks for having me.
Super practical, super helpful, and I think the nervous system is no doubt a big part of chronic pain, and psychology can have an impact there. So thank you for sharing.
Thank you so much.